Yan. So my topic will be on sustainable strategies on how to eliminate cervical cancer, and would like to show you Surveying AI, a new approach into the diagnosis and treatment later on of cervical cancer. So next slide. So okay, to eliminate cervical cancer, alam natin to, World Health Organization mentioned kanina, we need to follow the 70-90, which is 90 vaccination, 70 screening, and 90% treatment. Next slide. Ano ba ang scorecard ng Pilipinas? Ang scorecard ng Pilipinas ay, next slide please, 23% first dose, 5% full dose, that's vaccination. Sa screening, naku, 1% lang. Now, sa treatment, estimated in books 50 to 60%. And this is the reason why maraming namamatay sa cervical cancer dito sa Pilipinas. Next slide. Now, cervical cancer is the second most common in women. Nalaman natin kanina yan. Pero alam nyo ba, since 1970s pa yan. Up to today, 2023, it's still the second most common. Gising, Pilipinas. 11 women po ang namamatay. Whereas, kung kayo ay magmamigrate sa Australia, alam nyo ba, they are the first country in the world to eliminate cervical cancer by 2028 to 2035. What does this mean? What it means is that we can do it as well. If they can do it, we can do it. But how is the question? Next slide. Okay, let's shift now to screening kasi we talk about vaccination. Let's move now to cervical cancer screening. Ano bang maging problema with cervical cancer screening? Of course, we said lack of awareness, lack of facilities, kulang yung mga pasilidad na nagbibigay ng screening, lack of doctors, medical practitioners, midwife, no? Kulang yan, alam naman natin yan, no? Lack of patient compliance, yung pabalik-balik, no? Of course, we understand that, no? And then, ultimately, it boils down to cost. Next slide. Now, alam niyo ba, we all have those three tests, no? HPV DNA, Pap smear, VIA. We've been talking that the whole afternoon, no? Pero, alam niyo, the most recommended, as mas mentioned kanina, is HPV test. But problem is, with HPV, sinabi rin kanina, no? You go to high precision, it's about 5,800 pesos. You cannot, I mean, personally, I don't think you can afford to screen the whole Philippines at 5,800, of course, at this time. One solution I would want to divulge into is VIA. VIA is still good, however, may maraming disadvantages. Pero, there's a new technology that's coming out. It's the installation, the use of a colposcope. Kasi, when you do VIA, you're using your naked eye. What if you're going to use a colposcope? There has been promising results na. That's why the WHO has now adopted the use of a camera or a colposcope in VIA. Also, there's also promising results in the use of AVE. AVE is automated visual evaluation. Pagka-submit mo pa lang sa server, meron ng artificial intelligence magbibigay sa'yo ng resulta. May resulta na agad-agad. Ang kinikwento ko sa mga tao, nagpapanti pa lang po yung babae, may resulta na po. But that's not final, no? I'll go back. I'll go that in detail mamaya. And then you always have to remember that the primary screening test for the Philippines is still VIA at this time. Next slide. So this is what we use, so this is what we do. This is a colposcope. If you want to see it, it's right there in our table. VIA with a digital colposcope. Next slide. Of course, sinabi natin, ang VIA, mura. Ang disadvantage niya, inter-observer variability. Dalawang doktor magbabasa, dalawang interpretasyon nila. That's reality. But however, if you put AI, artificial intelligence, in the middle, it can serve as an objective component, no, to read. No? Number two, the use of a colposcope, kagandahan, compared to VIA, na naked eye ang ginagamit, the images are magnified. No? And it's documented. Alam niyo po, sa VIA, minsan dinodrawing nila yan eh. Whereas if you do a colposcope, automatically, the images are there. You can send it to the doctor can actually read it immediately. Remember, AI assists the doctors. Hindi ko sinasabing papalitan natin ng doktor. Never. AI assists the doctors. It is the doctor who will read the result remotely, telemedicine, or on-site. And lastly, centralize ang system. Ibig sabihin ng centralize, you can send it to any doctor you want, you can download it, you can send it to your patient instantaneously because everything is centralized. We want to share it to the Department of Health. Question ko, how? We want to share it to the LGU. Question ko, how? If we're going to do this. Next slide. This is a VIA naked eye ang gamit. This is VIA magnified colposcope documented. Next slide. This is a patient. Ito yung binibigay na resulta. We were part of Lab for All, no? The First Lady Marcos. Ito ginawa sa Office of the President. So ito yung pasyente. Ito yung binigay na resulta. This is our result. Single or detailed. Mamili ka. This is 7 pages. This is 1 page, all in PDF, all digital. But if you want to print it, wala namang problema. Next slide. Oh, how do we do it? So initially, we take a photo of the cervix, no? Para meron tayong pre-acetic acid. The midwife conducts the VIA. Then, it's autofocus naman. It takes photo of the cervix at different times, no? Autofocus yan. Huwag kayong matakot. It will tell you, hindi yan cervix. AI will tell you, hindi yung cervix ang kinukuha mo. Okay? It will, sasabihin niya, the cervix is small. Ibig sabihin, kailangan mong i-zoom ng konti. Maraming magagawa ang AI. Okay? You upload it, all the images uploaded, in 1 minute, you get the result. But this is a temporary result. Pupunta pa rin yan sa doktor. Next slide. The doctor now opens her dashboard, puts in her key password. Kita niya yung dashboard niya. Pili siya ng patient. Key in one patient. Ito na po ang kanyang dashboard. Nandito na yung mga pictures. Meron ng resulta si AI. Sinasabi ni AI negative. I-click mo yan, lalaki. Pag lumaki, meron ka ng annotation tools. Ito ba ay may mosaic? Ito ba ay may punctuation? Ito ba ay, you can put in whatever. Next slide. You can zoom the images up to 8 times. It even has green filter. Then the doctor will say, okay, I will try to evaluate. Is this negative? Is this of low-grade dysplasia? Is this of high-grade dysplasia or suspected of cancer? Once sinave mo, pag pinasa mo yan sa clinic, babalik yan doon sa midwife. In a matter of seconds lang click niya, she can already download a simplified or a detailed report. Ganun po siya kabilis. Next slide. Okay. So, ano po ba ang benefit nito? Okay. Kanina, sinabi ko yung mga problema sa cervical cancer screening. No? Now, balikan natin. Ano bang may tutulong itong machine na to doon sa problemang kinakukulan natin ngayon? Lack of awareness, sinagot na natin yan. Sinabi ko kanina, magkakaroon kami ng HPV awareness. No? Hey, ambassadors, sinabi ko kanina, magkakaroon kami ng community sexual arts. Hopefully, sana some of it you can use. No? Lack of screening facilities, boss, bigyan nyo lang po kami ng van. Lagay nyo yung portable device. You can screen the van, you can screen anywhere. Ang cervical cancer naman, ang screening naman yan, hindi naman araw-araw eh. Di ba? That's mainly every, 3 years, every 5 years. Depende sa inyo. You define it sa akin. Ako, we do it every 3 years. Then, you can go within 3 years. You can screen nyo lahat ng kwan nyo. You don't need to come up with a facility just for the screening alone. Number 3, lack of doctors. Now you don't need you need doctors, I'm sorry. But what I'm saying is, the doctors can be telemedicine. The doctors can be in Manila. They can read it. If they want to talk to the patient, there's Zoom naman available. Patient compliance. The results are immediate. You can bring this sa opisina. You can bring this sa in your workplace. You can bring this sa LGU, sa barangay. The results are immediate as long as the doctors are readily available. And like mentioned kanina, screen and treat. You can treat them immediately kung comfortable na yung doktor. Next slide. Now, ito yung pinaka-importante. What is the cost? Kasi no matter what I tell you, if it's not affordable, my gosh, you will go home. Wala tayong magagawa. Okay? Now, here's the cost. What is the cost of screening per patient? What? Ito, let's be specific since this is a localization summit. What is the cost for Calamba? If we're going to screen Calamba, Los Baños by 70% of the total population of women at age, sabihin na lang natin 25 to 55 kasi kinuha ko yun sa Department of Health. What is the cost? Next slide. Tingnan muna natin kung ilan ang population. Okay. So this is the population based on 2015. Okay. Sabihin na lang natin sa population na to, this is age 25 to 55, men and women. Sabihin natin, hatiin natin sa dalawa. So women lang. So ito yung women na population. Kunin natin ang 70% nito, this is 70%. Bakit 70%? Sinabi kanina, World Health Organization, 70% of babae should be screened. Although, sinabi nga nila, high performance test. Pero at least, we get to that. Ang total na kailangan natin i-screen is 57,313. Next slide. Kunwari, magpagawa tayo ng isang task force. No? Isang driver, dalawang midwife. Okay? No? Ito, ginawa namin ito sa Lab for All Palawan. No? This is with the Regional Director Mario Baquilod. No? We did that. No? Assume natin na isang task force can do 20. Kami po, pag lumalabas kami, we can do 30, 40 in 8 hours. Time is 22. That's 440 in a month. You multiply that by 12, you can actually do 5,280 in a year. You multiply that by 3, so you can have 15,840 patients screened in 1 year. Next slide. So, if that is the case, sa Calamba po, so yung taga-Calamba dito, kailangan niyo po ng 3 units. Sabay, sa Los Baños, you only need 1. Based on your population. Next slide. To screen 6,000 individuals for the next 3 years. Ibig sabihin, iikutan mo sila. The cost is 150 pesos per patient. So equivalent to 9 million pesos. Malaki ba yung 9 million pesos na hinihingi ko? Wait, sabihin niyo sa akin, Doc, asan yung sustainability mo? Kasi ang topic mo, sustainability. Wait lang. Next slide.